everyone, welcome to our Wednesday Lunch and Learn. Today we're talking about a really fun topic that's close to my heart, which is skin rejuvenation, anti-aging, what we can all do to keep our skin looking healthy and good. So this is my colleague Kelsey Holmes, our wonderful physician assistant. My name is Dr. Tareen. The format for today is first we're going to talk about basics of skincare, what you should do every day, little added things you can do every few months, and kind of little procedures and things we can do every year or two. Then we'll move on, we'll talk about some different products that you can incorporate into your regimens, things that you can buy both over the counter, things you can get from us, things you can get that are prescription strength. At the end, we'll do a fun little tour of all of our lasers and devices so you can see what platforms we use and how they work to really non-invasively and some of them invasively help your skin. And right at the end, we'll take your wonderful audience questions. But if you can chime in, we're noting your questions as we go so we can address those. First, the most fun part of every Lunch and Learn is to go over our names of the people who won from yesterday. So from yesterday's drawing, yesterday's topic was eczema, hand rashes, etc., and it is still recorded. So if you want to see it, it is still available. We have 5 wonderful winners who will get mailed gifts. So Diane Carlson, Megan Coolingham, Laurel Huberty, Kristen Spielman, and Andrew Guzik. So yay, congrats to all the winners. So we're going to talk first about anti-aging basics. So if you guys can zoom in on this, please. As dermatologists, we like to think of kind of what you should do daily, what you should do every few months, what you can do every 4 to 6 months, and what you can do every 1 to 2 years. The most important thing, the basis of skincare, are daily treatments and daily things you can do to your skin. So daily treatments, number 1, are cleansing with a good either creamy or foamy cleanser depending on what your skin type is. We love, as dermatologists, vitamin C's and antioxidants. I use a vitamin C serum every single day because it blocks free radicals from the sun. It also helps with brown spots and aging. Sunscreen is key. People really do get too bent on sunscreen, like, what should I use, what should I not use? What we tell all of our patients as dermatologists are mineral-based sunscreens applied regularly are the most healthy thing for your skin. Other things you should be doing on maybe a daily or every other day basis are using something called retinols or retinoids. Retinoids are topical vitamin A medications and they exert several functions. Firstly, they go into the nucleus of the cell, kind of the inside of the cell, and they stimulate collagen production. So retinoids are the only thing that have been shown to turn on your actual cell collagen production. They also really interestingly help you make new blood vessels, because as we age, our blood vessels get kind of thin and lazy, and these retinoids help plump up your blood vessels. So you'll see over time, if you're using a good retinol, your skin will look just a little rosier and a little more plump. That's because of A, new collagen, and B, new blood vessels. Retinols also exert their effect on the surface of the skin because they cause a little light exfoliation, so they help with brown spots and fine lines and wrinkles. So every dermatologist is in love with retinols. Many people ask me about so many other things. They're about growth factors, about peptides, about all of these things. And I always say, first look at science. Retinols have been around for 50 years and we know what they do molecularly and scientifically, and they've been proven. So make sure you're using a retinol. Everything else is gravy. What do you think, Kelsey?
Yes, those are the basic products, and I always tell my patients as well, don't spend $500 on a cream.
Yes.
There are no creams out there that are more expensive does not mean it works better.
Right.
It's a good rule of thumb to kind of go middle of the road. Don't get the cheapest thing, don't get the most expensive thing. And invest in good, solid, basic products before you start spending, $100, $200 on 5 different creams. Invest in the basics first.
Right, exactly. So daily, I'll just tell you what I use as kind of a middle-aged, more dry skin, prone to discoloration woman. And again, I think a lot of you know I have lots of kids. I kind of run this relatively big practice, so I don't like to do 10 steps. I do just a few steps. So every morning I cleanse my face just in the shower with no soap, because I don't need soap. I've been clean all night. So a lot of people get into the fallacy like, I need to wash my face in the morning, I need to wash my face in the morning. If you're oily skin, yeah, sure, you're welcome to, wash your face with like a clarifying type of thing. But if you're more dry skin and middle-aged, you really can just use water as your cleanser. Then after I get out of the shower, I apply this. This is one of my most favorite products. It's a vitamin C serum that's very potent with a high percentage of active vitamin C. It also smells really nice, which kind of wakes me up in the morning, and it gives this nice glow to the skin. So this goes right on my skin after I pat my skin dry after the shower. Then I apply a little bit of sunscreen. This is a mineral-based sunscreen. It's one that we make and sell, but you don't have to get this one. You can use just a nice light mineral-based sunscreen. In the winter, when I tend to get a little bit more dry around my mouth, I'll apply just moisturizer around my mouth before the sunscreen. But, sometimes you don't need extra moisturizer in the summer if you're more prone to getting greasy. And then makeup and, I'm out the door. At night, I wash my face either with this alpha hydroxy wash or a sulfur-based wash. I apply a light layer of moisturizer, and the key for me, in order to tolerate my retinols, because I'm in love with retinols, as you can tell, is to apply my moisturizer first. So I'll put this light moisturizer I love. In winter, I like this one. It's a little thicker. It's called Intense Repair. But in summer, sometimes I'll use Fortified, which is just a little bit lighter. So I'll apply my moisturizer first, let it sit while I, pluck my eyebrows or something like that. And then I'll put retinol. And I think you've heard my tips with retinols. I put it on my finger, and then I do 5 dots, and then I apply it all over. Many of you won't be able to tolerate retinol every night, but if you can even incorporate it a few times a week, that'd be great. What do you do as a sensitive skin person, Kelsey?
I do have very sensitive skin. So like Dr. Tareen was saying, I don't wear a lot of makeup. I don't put a lot of things on my face. So I very frequently just use water to wash my face. And again, if you're an oily person, you are definitely going to need a cleanser. But if you're not, don't be afraid to just use water. That's okay. I love our hyaluronic acid serum. As a dry, sensitive person, this is my go-to product. I actually use it both morning and night because I'm very dry. And this is a relatively benign product. It almost, everybody can tolerate it. It is, very close to our natural substances that are in our cells. So it's really difficult to be irritated by this. I love it too. I actually double it as my eye cream because the hyaluronic acid serum works to pull moisture from the air, and it can help plump up my super tired eyes from having young kids. So I usually use this, and I in the winter, I for sure have to layer moisturizer on top of that. And I typically use either a redness reducing cream, or I use CeraVe cream quite a bit actually. And it's a nice simple moisturizer. I can put it on my face to my toes, which makes it easy for me to get ready quickly in the morning.
And I want you to know, we're not here to sell you products. We are here to tell you the basic ingredients to use. You are our friends. This is an informational session. So please chime in and ask us what our favorite drugstore products are. Kelsey loves CeraVe. I love Cetaphil. We have a special guest star who's arrived. This is our wonderful esthetician, Jen. Please, Jen. So Jen, what are your favorite products? What do you use as your daily regimen?
Definitely the C. I love the C renewal serum. That is a staple. I use that every single morning. The intense moisture replenishment. It is not too thick. It is good on oilier skin. It will not make you break out. That is why it's one of my favorites. And also the alpha hydroxy cleanser. Definitely my favorite as well.
And I think Jen's a little bit more prone to like hormonal acne and things
Yes,
like that. So that's
absolutely.
why she uses.
Yep.
That's why she uses some of these clarifying types of things. Let's move on. Let's talk a little bit. I'm trying to maintain social distancing, so I won't be right on top of you. We're going to talk about kind of, people always ask me like, if there's one thing you could do to make your skin look better, what would it be? So we're going to move on and talk about kind of inexpensive, non-invasive, simple things that we can all do to make our skin better. Something called chemical peels, microdermabrasions, and microneedling. Kelsey, you want to take a little bit, do you want to talk about peels or microderms? And Jen, I know you love microneedling, so you can talk about that after.
So one great option is chemical peels, and these, as Dr. Tareen was saying, we recommend. Some people do them as frequently as every month, but you really can spread it out and do it every couple of months to kind of help maintain everything. The nice thing is we do offer chemical peels for all different skin types, so whether you have aging skin, whether you have sensitive skin, or if you have acne prone skin, there are different ingredients in our chemical peels that we can address. And you may not end up doing the same peel every couple of months because your skin does change. As we've all mentioned, during the winter we use different products because we live in dry Minnesota and that's just necessary. So and chemical peels are great for all ages. We have teenagers who do them for acne quite frequently, up to our older population who's doing it to treat sunspots and trying to stimulate plumpness and things like that in the face. So those are great. And I'll let Jen, do you want to talk about dermaplaning too, or?
Oh yeah, so we're going to talk a little bit about microderms and dermaplaning, which is a new service we're bringing on, and then we'll talk about microneedling. So one just little plug that I have are something called microdermabrasions. Microdermabrasions use a gentle diamond crystal to exfoliate the top surface of the skin. It is a favorite of every one of my family members. My mom comes in, my mother-in-law comes in, and they're always like, "Thank you, Mokiba. I'll watch the kids now. It's great." But it's a really low downtime procedure, and repeated microderms make the surface of the skin look better. Dermaplaning is a new procedure that we're bringing onto our Roseville and Maplewood offices. We've been doing them in Faribault for about a year now. Dermaplaning allows us to get off that dead vellus hair, kind of those blonde and those really fine hairs that don't go away with laser hair removal. But with exfoliating those, you also get that dead old surface of the skin gone. So again, these are microderms, and dermaplaning are non-invasive ways to just make the surface of the skin look better. Let's talk about microneedling next, which is a little bit deeper, but literally Jen's favorite procedure at the office.
Absolutely my favorite procedure. It helps with acne scars, it helps with more prominent lines, it helps with fine lines. The nice thing with microneedling is that we can go right up to the lash line, and it helps tighten all that skin up as well. Another benefit is that it helps tighten up all this kind of looser skin that you get as you age on your jawline. I feel like that is probably the biggest benefit with our older patients. Evening out the skin tone, there is a good, about 3 to 4 days of downtime with that. But you can apply makeup after 24 hours. So really it's not, too bad of a downtime.
Let's talk about price points, because a lot of times people ask us about price points and they think that these things aren't accessible. Microdermabrasions, chemical peels, kind of those surface things, we charge less than $100 at our office, or about $95 for the procedure. Microneedling, I think, is around the $395, $400 realm, because it does go a little bit deeper, stimulates more collagen. I will give you a little plug right now. We have something called the Diamond Club. Jen, you want to tell everyone about the Diamond Club?
So it lasts for a year. You can renew it every year. You pay $69 for a monthly fee and then $99 for an initial fee. With that, every month you get a peel, which we discuss when you come in. We have different choices, which I base upon when you come in that day, or a choice of microdermabrasion, and we are going to start with the dermaplaning as well. So we have many options actually during the monthly special. You also get, 20% off the products for the?
Yeah, you get a ton of product specials, filler special, Dysport special, and we like to think of it, all of us think of it as like exercise for your skin. Like once a month, you come in, you get some exercise for your skin. Should we move on to people always ask, like, what's Botox, what's filler, what's the difference? Am I a candidate for Botox? What do you think about Botox and Dysport, Kelsey?
Love it. It's one of those treatments that, again,
I do hers.
it's one of those treatments that is great for a lot of ages. You can start young and kind of as a prevention measure. It has actually been shown, especially in the eye area, to actually maintain elasticity longer if you start early in your early 20s and start doing any of the botulinum toxins early. We quite frequently, the way that Botox or Dysport are both brand names, and the way they work is they help to keep your muscles from actually making the movements that cause the wrinkles. So the most common areas to treat are between your eyes to help keep you from getting the frown, the crease between those eyebrows, the crow's feet along the edge of the eyes, and then the forehead are the most common areas to treat. There are a lot of other areas that can be treated, but that's the most common, FDA approved spots that are treated.
One kind of relatively newer area that all of us treat with Botox Dysport to reduce the muscles is the masseter, the jawline. I have had so many happy patients come to me after I treat this. Kelsey treats mine. I used to have a really square, somewhat masculine face, and by treating here, it makes me look thinner and more tapered. So that's a really nice option too. And more importantly, it helps with headache and teeth grinding. So people get like this awesome cosmetic outcome, but they more importantly, their headaches go away. So that's just kind of a little plug for that. But,
Yep.
do you want to talk about filler, Jen? What the difference is between the two?
Yes. Filler plus. So filler sits in the epidermis. It does not have anything to do with the muscle movement. I feel like that's what people get confused about the most. We use filler to kind of plump everything up. The majority is in your cheeks to make it nice, and it also glows because we use Restylane. Anything with a hyaluronic acid base will make your skin kind of give it that glow.
Right.
We can put some in here to help with these lines. Lips are always a favorite.
Totally.
Dr. Tareen does an amazing job with under eye filler.
Thanks. I need some myself.
But they're two completely different things. Filler fills, Botox stops you from making that muscle movement.
And we also have some other special guest stars who are going to pop in. Hannah, Nicole, can you tell us about your experience with Botox and Dysport, please?
Yes. Okay, well, first of all, I love Dysport. It's probably my favorite thing that I've had done here.
Same.
One thing that I was nervous about was just like the being too frozen, and I feel like that's a misconception that a lot of people have, especially at like a younger age too even, but it's literally you have movement, you feel natural. It's Dr. Tareen and Kelsey both do a great job at making you feel still very natural. And for me, my favorite part is the little eyebrow lift that you get. It makes you feel 10 years younger even if you're 16, so.
Yeah, I was most nervous about my eyebrows falling flat, but Kelsey and Dr. Tareen made me get a nice little eyebrow lift, which is the best part.
Yeah, it's awesome.
It is.
Awesome. Let's talk a little bit now about like the Austin Powers. Laser refers to a unifying beam of light. So there's many different lasers and they accomplish different functions. It's not just like one laser. We have lasers that target redness, that target brown spots, that target tattoos, that target skin rejuvenation, even vaginal tightening. So let's begin with KTP laser that targets redness. Kelsey, do you want to go over kind of a little bit about KTP?
Yes. So the KTP, as Dr. Tareen was saying, there are very specific wavelengths of light, and the laser basically targets this red color that you can see on the cheeks here. It helps with those broken blood vessels that usually the first spots that people notice are right around the sides of the nose. And if you're prone to rosacea, this is a great treatment to treat just that background redness that people get on their cheeks and their chin. So the laser targets that red color, basically heats up those blood vessels enough that it kind of helps collapse them down so that they permanently go away. This treatment is great because you see immediate results. You're a little bit red just from us touching you during the treatment, but you can really see almost immediately those blood vessels disappear, which is very satisfying for all of us.
Yes, very satisfying.
People often feel like they may look like they're an alcoholic or ruddy, and like they feel so much better. People feel so much more confident after they get the redness gone, which is
Absolutely.
And men love KTP.
Oh, men, yes.
Men love KTP laser.
They don't understand the difference that it actually makes. I feel like that's one of the lasers where people don't know that it's even out there.
Yeah, for sure. Let's move on. Do you want to take laser hair removal, which is an oldie but a goodie? Jen?
Yes. So laser hair removal, we can do 95% of body parts with it. We do these in packages of 9. You do need multiple treatments. I feel like the average is about 7 to 10. It also depends on the area, depends on the density of the hair to begin with. It can only see dark hair, so it can't see that vellus hair. It can't see red hair, gray, that light blonde hair. It can only destroy that hair if it's darker. Treatments are between 4 and 6 weeks depending on the body area. But like I said, the average is about 7 to, we do packages of 9, but about 7 treatments.
It's life changing.
Yeah.
It is, absolutely.
People, like, I used to have so much mustache hair and so much arm hair. People would be like, you look like a man. Like, people would say that to me. They're like, you have so much arm hair. And like, look at how good it looks now when I wear a short sleeve top. It like makes me feel so much better that I can't braid my hair, you know?
Legs in the summertime, that's a
Yes.
big one. I
Yes.
feel like Brazilian and Indian facial hair are probably the number one areas. Bikini, because a lot of people get ingrowns.
Yeah.
We touched on that a little bit on Monday, but yeah, the bikini area is my favorite because I will say my sister and I both got terrible razor burn and we both did the laser hair removal, and even after one treatment, those ingrown hairs and that irritation go down significantly, which is awesome.
Yeah.
For sure. Let's move on to lasers for acne scarring and just overall for little pits and scars. Kelsey, do you want to take CO2 laser?
Yeah, so our CO2 laser is a more medium depth to deep laser that we do, and it is great for these deeper types of acne scars. This is one of our treatments that has a little bit more downtime, so that's the one caveat for this, but it works great. And the nice thing about things like the CO2 laser is you continue to see results for 6 months after you do the treatment. So it's a really great treatment. You can see it can treat these deep acne scars and even people that just have general scarring over their face. It is a fabulous treatment for the cheeks and the forehead. It does help with pigmentation as well, so the people who tend to get red or brown scars, it's an awesome treatment to treat both at the same time. The other thing it works great for, we touched on this on Monday as well briefly, but some people can actually get these raised keloid types of scars from their acne. And these are really difficult to treat, especially if they're across all of your shoulders. But the CO2 laser can actually help to break up that thick scar tissue and help flatten them out and help normalize the color to your regular skin tone. The other thing we use CR2 for is for facial rejuvenation. So this is a great treatment. You can see some examples of under eye. As Jen alluded to, this is one of the harder harder
That's actually
areas.
Jen right there. But
Yeah. This is one of the harder areas, and it's something everybody is bothered by. And the CO2 is a great treatment because it actually helps to plump up the skin again. It helps your own body stimulate collagen to help fill in those fine lines, the wrinkles, the crepiness, and that kind of hollowing that everybody gets. This is a great treatment for everybody. And as you can see from these photos, you do get red and swollen from the treatment. But the under eyes actually heal pretty quickly. You know, anytime Jen does it, she looks a little beat up for a couple of days. And then after that, it's really easy to cover with makeup.
Yeah.
So
Yeah.
this is a great treatment for so many different age groups. It can be used for full face rejuvenation as well. And we do that less often just because of the downtime. And with bringing on microneedling, we haven't needed to use the CO2 nearly as much, which is great. But it still works great for people that have a little bit deeper wrinkles or want a one and done treatment.
Yes.
it is a great one and done treatment.
Yeah.
I will tell you, being somewhat middle-aged, I try to do a CO2 once every 1 to 3 years, depending on, you know, how much downtime I want, but it helps me not have to do a ton of stuff every day, just like, you know, going back in time, like 2 or
It's a
3
good
years.
refresh. Redo.
Yeah, redo, for sure. We'll quickly touch on tattoo removal. We have awesome lasers now that treat tattoos. Before, the lasers were very non-specific. They'd only pick up, you know, certain little pigments. Now we have great lasers that will take away all the colors and all the pigments and really can get you back to almost perfect skin. So that is a niche market. If you're interested in tattoo removal, that's something that we do offer. Any other lasers we haven't touched upon, ladies?
No.
You want to talk about brown spots?
I was going to say,
Yeah.
Gentle Max and skin tightening,
Yeah.
I think is
Yeah.
another one that, before I started working in dermatology, had no idea was a thing. And that one can make a really big difference too for this kind of neck, chin area that again bothers, you know, most
You
people.
love skin tightening,
I love
Jen.
skin tightening.
Jen does the most skin tightening, yeah. Tell us who you love it for, Jen.
Probably the late 40s to 60s are probably the biggest demographic for this. It's easy. You feel like you're in a hot tub for a good 20 minutes or so. You are a little red, pink afterwards for maybe a few hours, but not much more than that. The downtime on laser skin tightening is very minimal. You can go back to work right after, which is what a lot of the patients do after something like this.
I think it's pretty affordable too. How much do 3 or 4 treatments for less than $1,000 or something?
Yep. What is it? 4 for $875?
Yeah, 4 treatments for $875. So it's low downtime, low price, and good tissue tightening.
Yes.
Which that's why our patients love laser skin tightening.
Probably one of the number ones, especially with the minimal downtime to that.
Right. Where are we with time, guys?
It's about 5 minutes, right? 4. Yep, 5 minutes.
Awesome. Should we take some questions? And then afterwards, towards the end, as we're going through the end of our questions, we'll give you a little tour of our cosmetic suite, which will be soon moving across the street, because I think you all know that we are building a new office across the street, and the walls and the framing, a lot of it is being done. So we're excited to have an even more luxurious cosmetic suite for all of our patients. You want to start with questions, everyone?
Yeah, so Denise has 2 questions. She wants to know if you can microneedle with rosacea, and then wants you to touch base on collagen supplements.
Great. You want to take microneedling with rosacea?
Yep. I have done microneedling. The nice thing about microneedling, because it's not super irritating or there's not a lot of downtime with it, it works for all different skin types. It's actually really nice for sensitive skin people, because those are the people who have a hard time tolerating some of the daily products or some of the chemical peels and things like that. So it's a great treatment for all skin types. People with rosacea do tend to get a little more red than people who don't have it, so expect to maybe have an extra day or 2 of kind of red downtime. But otherwise, it's a great treatment for everybody. And it can actually help some of those blood vessels to be less noticeable, because your body is resurfacing and building more collagen to help keep those in the lower layers of your skin.
I'm going to embarrass Nicole right now. My assistant Nicole is filming. We're going to turn the camera on her. Nicole looks amazing after microneedling. She's got some rosacea. Go ahead.
I have rosacea even right now. No, but I feel like that's what I was the most nervous for, and I actually even saw a few patients after, and they didn't even really notice. The downtime is just a little redness that's easily covered up if you are going somewhere, but I mean, I feel like my skin is always glowing after, and even patients make comments about it, and I love it. So
awesome.
Yeah.
Where were collagen supplements. I'll take this because I like the science. I will tell you, collagen supplements are large chain molecules, so they are degraded in our gastrointestinal system. They are not absorbed wholly into the dermis. So as dermatologists and dermatologic surgeons, we're not necessarily proponents of collagen supplements orally. Collagen topically hyaluronic acid-based collagen, stimulants are what we recommend. Anecdotally, some people feel that their skin feels better when they take a collagen supplement. So I'm not saying it's harmful. I'm just saying that Kelsey and I don't take them. Jen, do you take collagen supplements? Yeah. So people who are somewhat in the know, we don't take them. But if you want to take them, more power to you.
Next one is, what is the best mineral sunscreen for darker skin types that's not going to leave that white tint on the skin?
I'll take that one since I'm a darker skin tone. So what you should look for on your label is something called micronized. Micronized means that the particles are really made into nano little spheres. That's why we like this Tareen. That's why I love my Tareen Dermatology sunscreen. It's actually got a little tint to it. So sorry, this one's not open, but if you put it on, it actually has like this little almost tan color to it. So I use it often in lieu of a foundation because it gives like kind of that glow. And my very, very Caucasian patients like it because it gives them a little glow. And my darker skin patients, like all my family members, like it because it just gives a glow to the skin without looking white.
Next one is, do you guys recommend vitamin C in the morning or at night?
You want to take that, Jen?
Because I use an exfoliant at night, either between the retinol or the benzoyl peroxide, I use my vitamin C in the morning. You can use it twice a day, but you're really not going to get that big of a benefit out of it. So morning for me, for sure.
I concur. Scientifically, the half-life of vitamin C, topical vitamin C, is over 24 hours. So I feel like you're wasting your money if you use it twice a day. You might like sometimes if I'm like really dry, I'll put a little bit on just as like a placebo effect. But I use my vitamin C in the morning because it's blocking, it's doing that antioxidant blocking rays from the sun. So you're getting your max benefit in the morning.
Is CO2 laser recommended for post-biopsy scarring?
You want to take that, Kelsey?
Yes.
It works great for all types of scarring. As we went through, it does help with those race scars. It also helps with the they call it atrophic scars when they kind of indent a little bit. So the CO2 works on all different types of scars, which is great because sometimes scars can actually have the features of both, the atrophic and the raised bumps. It does help to normalize the skin tone. And my favorite part, I actually had a very large biopsy of an atypical mole on my shoulder, which is a not
by us.
Not by us. I was relatively young when it happened, and it itches quite a bit. And I've done the CO2 laser on it a couple of times, and the best part is it helps to bring that elasticity back to that skin. It's on my shoulder, so I can feel it when it starts to raise up and get tight again. So it's a great treatment for all types of biopsy scars.
Last one, everyone's very excited about all the fun things we talked about, and they want to know when you guys will be taking cosmetic appointments again.
Me too.
We all had a moment of silence, everyone. I think we're putting people on the books maybe mid-May. Is that what we're doing thus far? Trust me, we all miss you. We all miss you very much. All of our receptionists are here. We're all they're actually working from home, but they're all on the phone. So if you want to make your appointments for our Diamond Club members, you're not getting charged. If you need any products, we are here. Jen, do you want to talk a little bit about things to do maybe to exfoliate while we're on break? Yes. Like some of your favorite pads. I'll tell you, while you're not getting your microderms and your peels, Jen will tell you about some of her favorite pads and peel, at-home peel types of things that you can do.
Yep. Melanage cream is hands down one of my favorites. Kelsey, you know this. For skin that's a little more sensitive, you can just use it once a week and it will give you great exfoliation.
What are your favorite products, what property about it? What things do you like in it?
It helps with the skin tone. So there's skin lighteners and brighteners. It's not as harsh, so it doesn't have a hydroquinone in it, which can tend to be a little more harsh on the skin. It has different skin lighteners and brighteners in it, but it does have the high strength, a retinoic acid in it. So you're getting the high strength benefit of a retinol. So it's going to help turn over the skin cells. It evens out the skin tone. It helps with fine lines. It's a good just overall for your skin, and it's going to get those skin cells turning over when you can't come in and do things like peels. Right. My number one for sure. Skin brightening pads I do love as well.
Yes.
Have you started using yours, Kelsey?
Skin brightening pads are I think something that a lot of us can incorporate while we're not getting our regular peels and microderms. They're mixed specifically for you with certain percents of brighteners and lighteners. How do you use your skin brightening pads, Jen?
You want to use them at night. I cleanse, literally take the pad out of the container, wipe, and you're done. Very, very simple.
Yeah, and people like it because it has that exfoliative property. I recommend those just once a week or so. But you can use them more depending on how much retinol and whatnot you're using.
Yeah.
We're almost done. I just want to tell you about two other little things that a lot of our patients ask about. Latisse and eyebrow thickening. So Latisse I've been using for over 10 years. I started after I had my first kid and the shit hit the fan. Latisse is a prescription grade product. You have to get it through a doctor or you need a prescription. It's applied to the base of the eyebrow and it stimulates eyebrow thickening and lengthening. So that is something that we can prescribe for you and we can mail out to you if you need it during this time. New Brow is one of my other new favorites. What I am of the generation where we, plucked our eyebrows and waxed our eyebrows super, super, super thin. So it's hard at this age to get thick eyebrows again. So this product actually is really natural and has botanicals and helps thicken up the brows. I personally tried Latisse on my brows and it didn't do very much. And I've tried all the Rodan and Feel stuff. This New Brow has really helped me thicken up. Any other little tidbits of things that people can do during this time when they're sitting at home? Kelsey, Jen?
Make sure you keep up with your skin regimen. I feel like people kind of have gotten into this rhythm of not wanting to do things, but to preserve your skin, you do want to use the products that you have at home or can do at home.
My daily tip, one, don't overdo it if you're bored. Don't put on
Yes.
a mask every night and don't use exfoliants and all types of charcoal and whatever. Don't do that. Keep it simple. And then the other thing too, just put on sunscreen every single day. It's a habit to get into. Once you get into it, it is not a big deal, but especially in these times when you're not in a regular routine, you might be popping outside more often than normal, and the sunscreen will make the biggest difference in long-term skincare.
Awesome. Thank you. We will be mailing you your gifts, and our first 5 Diamond Club members who checked in, you get a free full-size product that you will get in the mail. Hope you love it. Thanks. See you tomorrow.